Well, we're joined with a very special guest, a dear friend, and I know a few folks right around Delta here know Mr. Sandy Weathers. Good morning, Sandy.
Good morning.
Now, every Tuesday we get to sit down with somebody from Greenwood Leflore Hospital. You actually worked for them, and you were with the Willow Anesthesia as a CNRA at Greenwood Leflore, and president of the Mississippi Association of Nurse Anesthetists.
Yes.
For those that don't know, CRNA, what is that?
A CRNA is a certified registered nurse anesthetist, which is an advanced practice nurse. It goes into specialized training, about 3 years typically, and specialized anesthesia training to take care of patients safely. There are about 50,000 CRNAs across the United States now, safely delivering about 35 million anesthetics a year to our patients.
Wow, and really and truly probably one of the most important jobs in the room, making sure we get down and wake up pretty safely. How, you know, you guys as president, you oversee a bunch of folks. You know, how experienced do these folks have to be that do this?
Well, in our group at Greenwood Leflore Hospital, we have 9 anesthesia providers, 7 of which are CRNAs, 2 anesthesiologists, and we represent over 140 years of combined experience.
Wow, that's amazing. Now, what all do you guys do? I mean, I know you obviously, you know, what services do you provide as CRNAs?
Well, first and foremost, we provide anesthesia in the operating room. We also have a preoperative clinic. You know, we want our patients to come in and understand that we know that people are anxious coming in, and we want to be able to help with the anxiety coming in and let them know what their expectations are. We also provide labor epidurals for pain management for labor room patients. And we also provide sedation and anesthesia services in our endoscopy suite.
Now, I've heard about acute pain service. Now, do you guys do acute pain service as well?
Absolutely. We have one of the largest acute pain services in the state, actually.
Okay.
What we do different nerve block procedures to minimize patients' pain post-operatively. You know, the nice thing about the nerve blocks and pain management with that technique is that it minimizes the side effects from narcotic pain medication.
Right.
So the nice thing is, you know, patients have a better recovery, speedier recovery, and out of the hospital quicker.
And let me ask you just 2 more quick questions this morning. You know, folks that go in for surgery, I mean, obviously whenever you deal with, you know, putting the body down, I think there's probably some patients that get afraid. Should they be afraid, or should they be, you know, should they be okay coming in?
That's a great question, and that's why we like to have that interview. We like to help put patients at ease. You know, I'm very comfortable having those discussions with patients. Just to be quite frank with you, I had surgery 2 weeks ago. And so I know what it's like to be on the other side. We have a very experienced crew, and I'm very comfortable to say that, you know, I had surgery at Greenwood Leflore Hospital and had an outstanding experience. Was back at work 3 days later.
Oh my goodness. So don't have to be afraid. You can go in trusting that the experience is there. It's going to make sure you wake up. Is there any long-term effects that folks may have if they do, you know, getting put under, stuff like that?
Well, the nice thing about the, you know, present-day anesthetics is that the medications that we use are very short-acting, and they have very low side effect profiles, so we try to minimize that. There are things that can come up in surgery, but absolutely we want to do everything as safely as possible, and those risks are very minimal. Well,
I'm so thankful that technology is advanced, and education. You guys are so experienced and intelligent over there to make sure people stay safe. Thanks for coming in and sharing with us this morning.
Appreciate it.
Stay with us. We've got more coming up after the break, finishing out in the kitchen with Miss Dolores. We'll be right back.